And it's also important to understand that there's a lot of comorbidity with the prenatal alcohol exposure and with FASD. So Dr. Popova is a Canadian researcher who's done a lot of epidemiologic studies in alcohol exposure in Canada and worldwide. So she has found over 400 comorbidities. So I think the point for me is that these individuals are showing up everywhere. So everyone in this room has come in contact with someone with fetal alcohol spectrum disorder in your clinics, in the work that you do, and you probably don't work at a specialized clinic because they're showing up in psychiatric clinics, in medical clinics, needing social support, and so on. And so I think that, again, the point is we have to think about it. So we might have a clinic for anxiety, or we might work with people who have social needs, but we have to think, some of those people are going to have prenatal alcohol exposure or FASD that's perhaps unrecognized, and they'll do better if we can recognize it and help them with that part as well. And FASD is a Canadian group that supports research and policy in FASD. They have a national database. And what this slide shows is really the same thing that Dr. Popova showed, which is in the blue, these are kids referred to various clinics. The blue line are those who had FASD, and they have a much higher incidence of comorbid symptoms. If you look at mental health problems, those who get a diagnosis have a much higher rate, and other health issues. And there's actually a group of individuals with FASD who are undertaking a Canada-wide study looking at all the associated health problems above and beyond some of the neurobehavioral things that we typically look at that are occurring in people with FASD. And it's costly. So it's costly to society when people have FASD. We provide mental health services, medical services, but also at special education, youth justice, and so on. And so a lot of effort, and I'm not talking about that today, needs to go into prevention. Part of that is education in terms of understanding what alcohol can do. But part of the cost, I think, is trying to figure out how to use it most efficiently. So the little picture up on the right is a stack of assessments that a patient I saw had done prior to coming to see me for a diagnosis of FASD. So that's a lot of assessments. That's a lot of, okay, this isn't really quite explaining everything, before finally coming to some understanding that part of the reason that some of the other treatments didn't work and the other diagnoses didn't explain things was because it was FASD. And so Angela did some work during her master's degree and estimated that in one particular child there was almost $95,000 worth of prior assessments before someone thought about FASD. And this doesn't speak to the cost of the individual who has to kind of go through all that, just not feeling like they kind of really understand themselves, or parents feeling like they're doing something wrong, when in fact there just isn't quite the understanding there yet.